Great, thank you, Kathy. All right, let's go to the next screen, please. Next slide. I just wanted to begin today by acknowledging that I have the honor and privilege of living, working, and playing on the unceded and ancestral stolen territories of the Coast Salish peoples. That's the Squamish, the Tsleil-Waututh, and Musqueam. So we give great thanks as settlers to be allowed to work and play here. Next slide. Yeah, so just a really quick intro to me. So I've worked in BC for over 30 years as a public health nurse. I've worked in 3 of the 5 regional health authorities, 7 years at the BC Centre for Disease Control, 5 with the Ministry of Health, and then 7 with First Nations Health Authority. Right now I'm working with the Public Health Agency of British Columbia, supporting the immunized BC nurses. Next slide. My conflict of interest disclosure is that Sanofi Pasteur is graciously providing an honorarium for this event. Thank you. All right, so this is why we are here. So these are actually my husband's parents. We've been married for almost 30 years as well. So mom and dad are very near and dear to my heart. Mom is just turned 90 and Papa on the right just turned 91. The World Health Organization has this beautiful quote when we are thinking and discussing the elderly in our lives, and that is that everyone in a society benefits when we keep older people at the heart of our families and communities. And it's becoming really evident to me in this last pandemic, SARS-CoV-2 or COVID-19, that there are some parts of our society, I think, where we have to get better at communicating the value of everybody in society and why it's really important to protect our really vulnerable. And so, yeah, so I'm just really honored to be here today and to talk about a really important thing, and that is keeping our seniors as healthy as possible. And Kathy, to your point, keeping them, at home, and if they go into care, keeping them as healthy as possible there as well. I also just wanted to say at this point that if there are any caregivers that are with us this morning, that I wanted to say a very deep and heartfelt gratitude and thanks to you for all of the work that you do in keeping our parents well. My dad has just gone into care. He had COVID over Christmas, unfortunately. He got so sick, he fell and broke his hip. And he's been in acute care now for over 50 days and moving into long-term care. So that's a story of what happens when infectious diseases can have a long-term impact. That being said, I do want to say on a note of hope that he's receiving excellent care within the system, and that we're really looking forward to his placement in long-term care where we'll be able to spend more time with him. Next slide, please. All right, so today we'll talk about healthy aging and aspects of that where we have any sort of agency and control. And we'll focus on vaccine preventable diseases, and we'll look at the disproportionate impact that communicable diseases have on our elderly. And we'll have Ronnie Sharp is joining us this morning to share her story about her and her husband's experience with influenza 2 years ago. We'll talk about vaccines as part of your wellness plan. We'll spend a lot of time talking about influenza high dose. This is a new-ish vaccine that we highly recommend. And I want to say right off the bat that my husband and I spent a lot of time and energy in the fall ensuring that mom and dad had the high dose vaccine for that added and extra protection. We'll talk about tetanus, diphtheria, and pertussis vaccines. We'll talk about shingles. Everybody likes to talk about shingles. We'll talk about pneumococcal vaccines, and then of course, COVID-19, if we have time. And then I have some resources for folks, and hopefully we'll have time for questions and answers. Thank you. Next slide, please. All right, so the World Health Organization, fondly referred to as the WHO, refers to healthy aging, or defines it, I should say, as the ability to develop and maintain functional ability, which is, if you look at the bottom of the screen, is our intrinsic capacity plus our environment, plus our interactions with our environment. And so we'll be focusing on our intrinsic capacities today. But what's our goal is that we can meet our own basic needs, that we can make our own decisions so that we have our own agency, that we are moving, that we are mobile. Our family is realizing more than ever the importance of mobility since Dad fell and broke his hip. The ability to build and maintain relationships and make a meaningful contribution in society. And I'm not referring to finances. As we know that our elderly, our seniors bring so much wisdom and life experience and laughter and joy and love and all that. And and so it's really, really important as a society that we lift up the voices and the health and well-being of our beloved seniors. Next slide, please. Okay, so when we look at intrinsic capacity and we drill down further, we're looking at the ability to walk, think, see, and hear. As we know, the ability to hear particularly is really important when we're trying to have protective mechanisms against dementia and, of course, remember. And what is our intrinsic capacity influenced by? Well, number one, the WHO put down presence of diseases, both vaccine preventable and not, injuries like breaking your hip, and of course, age-related changes. Next slide, please. Well, here's a great slide that I've borrowed from my colleagues at Sanofi, and it's a picture of what can happen when we look at our functional ability. We know that hospitalization can actually lead to a significant decline. So on the left of your screen, if you look at usual aging, that it's just normal for us to progressively lose our strength, our bone density, our skin becomes thinner. We might develop some bladder issues. But then if we get into the hospital system often, and we saw this a little with Papa, that, you know, the diet has changed. He was on a COVID ward, so physio, they weren't able to get him up and moving. So he lost bone density, he developed pressure sores, and then, you know, the dehydration and the falling and the fracture actually happened at home when he was sick with COVID. And again, because of the restrictions in BC, we were unable to be with him and care for him. And that's when he fell. And so he's now moving into more dependent care. So today we'll focus mostly on influenza and how that can produce significant and long-lasting functional decline in older adults, but we really want today to be a message of hope. We don't want you to feel that there is nothing that you can do to protect yourself and your loved ones, because there is. And that's the main reason why I'm very passionate about vaccines. Because it gives us the ability to make choices to protect ourselves and our loved ones, and B, because I believe it's part of our sort of social duty to protect our most vulnerable, who, and we'll learn later in this presentation, can't necessarily develop as a robust or as a strong response to vaccines, and that specifically are under 2 years of age, are over 65 years of age, and anyone in the middle that has a disease or a condition that leads them to become immunocompromised or immunosuppressed. Thanks, Kathy. Next slide. All right, so when we look at hospitalization of our adults 65 years of age and older and independence, there was a poll that was done, and if you look at the loss of independence, that was the #1 fear of a majority of Canadians polled over the age of 65. And if you look at, again, just further drilling down the point about hospitalization leading to long-term dependence, over 1/3 of community dwelling Ontario folks 65 years of age and older that were discharged from non-elective hospital stays. So that means, you know, like a fall, for example, with a broken hip, were discharged either to home care or long-term care. So again, we're trying to keep folks independent and in community as long as possible. And one way to do that is to protect ourselves and our loved ones from infectious diseases. Next slide, please. All right, so we know that communicable diseases disproportionately affect the elderly, and here are the reasons why. So again, there's this big word that you'll be hearing a lot in the news these days because of COVID-19. And COVID-19 has really elucidated for us as a society that the elderly are really at risk. And why are they at risk? Is because our immune systems, as we get older, our immune systems tend to break down and become weaker. So for example, even like our skin, which is our #1 thing of defense to protect us, our skin gets thinner, so we are more prone to infections. Our cells replicate at a slower rate, so it's harder for us to recover from disease or injury. Our immune system is impacted by less production of our white and red blood cells. We sleep less, we have less REM, so we have less sleep. That has an impact on our immune system, et cetera. And then of course, any underlying health issues that happens to us as we get older, like diabetes, et cetera. So yeah, so we are focusing on communicable diseases again, because this is an area that we can control. We can have quite a bit of control over. And we wanted to impart that message of hope for you this morning. All right, Kathy, thanks. Next slide. Again, we just wanted to show you a beautiful picture or a graphic that demonstrates that even though adults in Canada represents 15% of the Canadian population, that they're overrepresented in hospitalizations due to influenza and deaths due to influenza. So only 15% of the population are 65 years of age and older, but 70% of all of our hospitalizations and 90% of all of our deaths due to influenza happen in that age group. Thanks, Kathy. All right, so we do have Larry's story. Kathy, if it's okay, let's try to show the video. The video is only 3 minutes long. So Ronnie, I hope that's okay with you. We'll start with the video and then I have 3 questions that I'd like to ask you.
Perfect.
All right, thank you. While Kathy's...
Bear with me.
Yeah, no worries. While Kathy's doing that, Ronnie, do you want to just set it up for folks?
Okay, certainly. The way this transpired is that we were talking to someone and they asked if we had a flu story. And we did have a flu story. And so they asked if we would produce the video and tell our story. My husband and I thought that if we told our story and encouraged even one person to get vaccinated against the flu, we have done a good job. So that's why we did our story.
Thank you, Ronnie. And Kathy, before you hit play, Ronnie, could you just let us know, so you are Ronnie and Larry Sharp from?
North Delta, BC.
North Delta, BC. Awesome. Mm-hmm. Okay. And this is their story. Thanks, Kathy. Thanks.
Before contracting the flu, we thought we led a very healthy lifestyle in general. We eat a very balanced diet. I still work full-time. We did a lot on weekends.
Enjoying walking, cycling, canoeing, camping, times with family.
This past March, we were on a family vacation in Hawaii, a family reunion, and I wasn't my active self. I became progressively sluggish and tired, and Ronnie had decided at that point that it was time to go to the clinic. It turned out I had contracted influenza A and had pneumonia on top of that. When I got to the hospital, I found out that my blood oxygen level was only 20%. There was no way Ronnie could come in because she too was ill and contagious, and I was on an isolated ward. The nurse was checking me in, and she asked me at that point if I had my affairs in order and whether I wanted to see a chaplain.
I didn't quite realize the impact about how life-threatening this situation was. None of us really did at that point. The flu had taken such a drastic toll on him.
I was essentially bedridden, and if I did want to get up, I had to have someone assist me, and That was a bit of a shock again, having been active and all of a sudden realizing I couldn't do things on my own. We got a wheelchair to help me with my mobility, and I also got a cane for stability. It was a bit of a shock to all the kids to see Dad in a wheelchair.
They were devastated to realize that their strong, active dad is lying in this bed.
It was at that point I think that they realized we almost lost Dad. Life certainly wasn't normal for a long time. I had no energy. I had lost a lot of muscle mass. There was no way I could consider going back to work at that time.
We tried to go do our dog walk, and we got halfway around the corner and had to turn back. He's still improving, but he's not 100% even yet.
Anybody could end up in that circumstance, no matter what your health status and lifestyle had been up to that point.
Now we have the opportunity to rethink this and to advise our friends. Seniors are vulnerable for the flu. When they get the flu, it appears to hit them harder. You have to be your own health advocate. You have to take care of you.
Thank you so much, Kathy. So Ronnie, there were a couple of questions that you and I had talked about. I mean, that was a bit of a quick, review of your story. Is there anything that you'd like folks today on this call to know a little bit more about the story?
Well, first off, I sort of thought about this. I have seen the video many times, and I wanted to impress that we were and have been very active seniors. We cycled from Amsterdam to Bruges the year before. We cycled Myra Canyon down to Penticton. We've done a lot of bike rides, hiking, walking. We keep very, very active. And we thought that that in itself, the exercise, the fresh air would protect us against these things. Our trip, we were imagining this absolutely wonderful, fabulous time with family, which we all enjoy very much. And it was cut short quite abruptly. And we want everyone to know that it can happen to anyone, whether you're less active than we are, or whether you're out and very active, but you have to take care of yourself.
Oh, thank you, Ronnie. Can you share with us, how is Larry doing now? This happened, I think, 2 years ago. Is that right?
It was 2 years ago. He has steadily improved. He was very fortunate. Some of the others that end up in hospital with a condition like he was in are not as fortunate as he has been. But his stamina has improved, but it hasn't reached the level it was prior to having the flu. Now, part of that might be normal aging, but I attribute it to the devastating effect the flu had on him. Right. He's still working full time. I keeps him out of my hair, and he enjoys it. It keeps him active and interesting. However, he's more tired when he comes home, and he goes to bed much earlier than he used to get the rest that he needs. But we're 100%. We're doing what we like to do within our limitations, and we are very fortunate that we have him with us.
And Ronnie, thank you so much for that. Can you share with us, and if the answer is no, that's fine, but did the experience change any of your thoughts or impressions or beliefs about vaccines, either before or after?
We have always been very positive for having vaccinations, be it the children's ones, the measles ones, the any of them, and we've had them all, believe me. But now it has just reinforced the importance of it. If you can prevent something, prevent hospitalization, which can have a devastating effect on you, go ahead and do it. Take care of yourself. And vaccines are a definite way to do it.
Thank you, Ronnie. Thank you so much for saying that. And I do want to bring that into the room, that you'll find like infectious disease specialists or folks like myself that work in infectious disease or communicable disease, we're really passionate about vaccinations because we bear witness to stories like yours, Ronnie, right? Where we see the devastating impact of a vaccine preventable disease. Now, what Ronnie, and I hope this is okay to share, Ronnie, what you haven't said though, is that you and Larry had been immunized the year that Larry got influenza.
We had been, and we actually were very surprised that it was influenza, but it is my understanding that there are certain strains that are in certain vaccines, and unfortunately the one that we had was not included in that vaccine for the year for whatever reason. And so it really didn't protect us. Part of, I think, Larry's problem is that when he wasn't feeling well, he thought, I'm in Hawaii, I can lie down, I can read my books, and I cannot move. And I think that that was one of his mistakes, but he likes to play poor me when he gets ill. So it was difficult to ascertain whether his illness was the flu or some of his other health-related issues.
And thanks for saying that, Ronnie. Sorry, I just wanted to bring into the room the truth and the facts for folks, right? That influenza, there's lots of strains, number one. And number two, that there are 3 or 4 strains that are included in vaccines every year. You know, and so some strains, to Ronnie's point, are not included, and that's the way that this works. But also that influenza, the virus itself, can be quite capricious, or it mutates and changes a lot. And so when the virus changes, you can also get a drifting, and the vaccine doesn't work as well. And the reason why I'm saying all these things is that it's just an important message around why we should get our influenza vaccines every year, right? Because it's not a once in a lifetime thing, because the flu viruses change all the time. And that when we talk about a high dose formulation that works much better in those of us as we get over 65. So that's why you'll be hearing me promoting high dose Fluzone vaccine, because it works better in folks over the age of 65. Ronnie, is there anything that you'd like to kind of impart to this group in your wisdom?
No, we were very, very fortunate this year to be able to have the high-dose flu vaccine. We signed up with an organization that did provide it for us, but we would personally hope that sometime in the near future, the BC will consider providing it, whether we have to pay for it or not, so that should you want the more effective seniors vaccine, you can get it. Awesome. I don't know whether that helps you or not.
No, it does. Thank you so much, Ronnie. We are so grateful for you to come, and please extend our gratitude to Larry as well. You know, because we know that often for us humans, it's our experiences that change our behavior. And even though this experience didn't change your behavior, you continue to get vaccinated, but your willingness to be vulnerable and tell your story and share your story, hopefully will be the experience that will change others' behavior. So thank you so much.
Oh, you're very welcome. That was our hope too. Thank you.
Thank you. Kathy, are you okay to put the PowerPoint back up? Thanks. Ronnie, will you stay with us for the rest of that?
I would like to, if I may.
Okay, great. Yeah, please do. Thanks. Okay, next slide, please, Kathy. Sorry, yeah, next slide. All right, so we call this speed dating with the influenza virus. Influenza is an RNA virus. So other RNA viruses are like HIV, coronavirus, SARS-CoV-1, SARS-CoV-2. RNA viruses change a lot. They're, again, like I said, they're capricious. Kathy, I'm not sure what happened. I can't see the slide. That's okay. I can keep talking about. Oh, I can't. Oh, there it is. Great. We have two lineages of influenza viruses. We have A lineage and B lineage. So exactly what Ronnie was talking about, that you can have different A strains and different B strains. So for example, A strains would be like H1N1. That was our pandemic strain that emerged in 2009, and it continues actually to be part of our vaccine programs today. Influenza viruses are highly infectious. They're spread by respiratory droplets, just like SARS-CoV-2 or COVID-19. But unlike COVID-19, the flu incubates for a really short time, like 1 to 3 days usually. So it'll rip through families, it'll rip through facilities. People are communicable or contagious or infectious 1 day before they develop any symptoms and 5 days after. So influenza comes on really quickly. People may have a bit of a sore throat. Remember that it is a respiratory virus. So you have to have some type of respiratory involvement for it to be considered influenza, like a cough, and definitely fever we'll see, and a worsening of chronic conditions. So folks that have like diabetes or other or heart disease will feel sort of that that's worse than usual. Some groups are at higher risk of more severe complications. And again, that's our under 2s, over 65, and people that have immune compromising conditions. And just like COVID-19, not everyone that has influenza gets sick or shows symptoms. So you can have asymptomatic carriage and transmission. Next slide, please. All right, so just like COVID, we recommend that folks stay 6 feet away from each other. The influenza virus can live on surfaces for 1 to 2 days. And of course, if you're touching those surfaces and then touching your eyes or your nose or your mouth, that's another way that you can be exposed to this virus. Who's at increased risk? Again, folks living in facilities, and those of us getting older, and those of us with immunocompromised conditions. Next slide, please. All right. Now, 75% of us 65 years of age and older have one or more chronic health conditions like obesity or heart disease or diabetes or kidney disease. Or lung disease, chronic obstructive pulmonary disease. So that puts the vast majority of us at high risk of complications from influenza. Next slide, please. The direct effects on the respiratory system of influenza can be that it can exacerbate or make asthma or chronic obstructive pulmonary disease worse. It can lead to ear and sinus infections for folks that can persist for a long time. And of course, it can lead to secondary bacterial pneumonia or bronchitis. Indirectly, it can trigger an acute heart attack or a stroke, and it can be an exacerbation, or it can irritate and bring up an exacerbation of kidney disease or diabetes. Next slide, please. All right, so just a couple of flu myths. People will often say, I don't want the flu shot, it can give me the flu. I use a tired, maybe an overused analogy that says that, with our inactivated vaccines, that would be like asking ground chicken to lay an egg. You cannot get influenza disease from the influenza vaccines. They are inactivated, they are killed. And so that's not so. The myth that it's better to get influenza disease than the vaccine, well, I think we just took a little trip down the story lane about what influenza disease actually looks like for those of us at greatest risk. Yeah, a myth. I should wait to get vaccinated so that I'm covered through the end of the season. And no, we want folks to get it, you know, in October or November, because we know that it'll last around 6 months. So that gets us through the main flu season within Canada. So those are just a couple of flu myths and facts that we wanted to review with you today. Thanks, Kathy. All right, a quick word. We have to bring the twindemic into the room. Next slide, please. I'm just highlighting here for you the difference between influenza and SARS-CoV-2. You'll hear me call it SARS-CoV-2, and I think it's important for people to understand sort of, you know, that coronavirus is part of a family of viruses that we have seen before and we've developed vaccines for before. So we want, again, to impart a little bit of hope and understanding for people. When we look at the difference between these two respiratory pathogens, we see that COVID-19 is far more infectious. So the top row is what we call R0, and that means the number of people that if you have the disease, the number of people that you are most likely to infect. So with the flu, it's about 1 to 1 or 1 to 1.3. So if I have it, I'll infect at least one other person. With COVID-19, one person will infect at least 2 to 2.5 people. As you can see, the case fatality rate is 0.1% with flu. It's much higher with COVID-19. The mean incubation period for influenza is a lot shorter, again, so it can rip through places faster. It's longer for COVID-19, up to 14 days. And the hospitalization rate is much higher for COVID-19, but it's still, as you can see, that's significant. On the left, the hospitalization rate for influenza. And then, of course, if you look at those of us that are infected globally on an annual basis, it's over 1 billion. And that's what we know about. So often the mathematical modeling will show that it's probably higher than that. Thanks, Kathy. Next slide. All right, so this next section, then we'll look at how do we prevent certain vaccine preventable diseases. Next slide, please. And we'll start with just a quick review of the BC Immunization Program. So the way it happens in Canada is that the Health Canada starts with approving a vaccine. So it's like the FDA in the States. So Health Canada says, yep, this flu vaccine can be licensed for use in Canada. Then the National Advisory Committee on Immunization, they decide whether or not they decide the groups of people that should receive vaccines. They make recommendations, and then it's up to the individual provinces on whether or not they will accept those recommendations. So the vaccines in BC can either be funded by the Ministry of Health, and those would be available at public health units through family physicians, nurse practitioners, or pharmacies. And then there's vaccines that you can purchase. So these are vaccines that are recommended by the National Advisory Committee on Immunization. And because that's a really long name, I will refer to them as NACI, but they are not funded by the Ministry of Health. And the Ministry of Health makes those decisions based on lots of points of information. One of them is cost-effective analysis. And so even though NACI might say that this vaccine is recommended on an individual level to protect people, they might, through their mathematical modeling, decide that it is not cost-effective to pay extra amount of money for a vaccine to protect folks at a population level. I'm not sure if that's making sense, but what I need you to know is that there are some vaccines that will be funded and so are free to you, and there are some vaccines that are not, even though they are recommended by a national body. Next slide, please. All right. On Immunize BC, you will find some information, and actually, Kathy, I'll send it out. I'll send some links out for folks if you can disperse it after this. But we do have a lovely pamphlet online that will talk about non-publicly funded vaccines for adults to consider. And we'll go over 4 or 5 of those today. But I wanted to flag this resource for you. Thank you. All right, so we know that influenza vaccination, although it does have its challenges that we were talking about, like mismatches or circulating strains that drift, But that being said, we know that vaccination is the best way to prevent it. Again, influenza virus is pretty tricky. It changes a lot. But if you look at this slide, it shows you that, that vaccines protect us. Depending on the year, you'll see on the left, it says influenza vaccine effectiveness. It will span anywhere between 40 to 80%. Sometimes higher than 90, depending on the strain and the year. But the most important thing from this slide that we want you to take home is that vaccine efficacy as we get older decreases. And that's with all vaccines, not just influenza vaccines. So vaccination is effective. And we have to get more creative as we get older because of that word immunosenescence, or because of our immune systems getting older and needing more of a boost for us to get protective antibody levels. Next slide, please. All right, so influenza in Canada often will be split between A and B influenza viruses. In 2019-20, we had about a 60-40 split. Of the influenza A viruses, about 60% were H1N1. So this is still the pandemic strain from 2009 circulating, and about 40% were H3N2. Now, H3N2 is the strain that can be quite problematic in our seniors. H1N1 was the strain that we saw in 1918, 1919, the Spanish influenza pandemic, and we still see from that, and then from subsequent H1N1 strains circulating, that our elderly have quite a robust response to that with their vaccinations. It's the H3N2 that can be problematic. And so for 2019-2020, the vaccine effectiveness, which is the performance of a vaccine under real life conditions, unlike vaccine efficacy that we see only in clinical trials. If you look at it for the 2019-2020 flu season, the vaccine efficacy was about 58% for any flu strains. And we had a really good match that year for H3N2. It was about 62%. And it was about 69% or 70% for influenza B. All right, thank you. Next slide, please. All right, so look at Ken. You're mowing my lawn, but I love it. You've got the right information. So the National Advisory Committee has made recommendations for folks who are 65 years of age and older, and that is that they receive this inactivated high dose Fluzone vaccine. And I'm saying Fluzone because it's the only licensed product in Canada that is high dose. So this is an inactivated vaccine. They have the trivalent, so it protects against 3 strains. They also have a quadrivalent protecting against 4 strains, so 2A, 2B. And the National Advisory Committee on Immunization has recommended this individually. So it's not funded, but it is recommended. And just like Ronnie said, and just like I did, we did our work to make sure that we could purchase it for ourselves and well, I wasn't able to get it. It's not licensed for use under the age of 65, but for my mom and dad this year. NACI said that there's insufficient data at this point to make comparative individual level recommendations on the other influenza vaccines. But there you go, there's your recommendation. And Ken, I love that you know that. I love that you know this group, and I love that you know that this is their recommendation. Next slide, please. All right, so what is Fluzone high dose? So this is when they take the antigen. So the antigen, and I'm gonna lean on COVID-19 right now because it's in the news and everybody understands it. So when you take coronavirus, it's like a tennis ball that has these spikes right outside of it. And it's the spike protein that is the antigen or the piece of the virus that they're developing vaccines with. That what they do with the influenza virus, if you look at influenza virus and coronavirus, they actually look pretty similar under a microscope. So they take like those nails or those spikes with the influenza virus, and those pieces on the outside of the virus are what we call antigens. And what we know is as we get older and our immune systems decline, that we know that if you give 4 times the amount of antigen, 4 times the amount of those little pieces of the influenza virus, that you get a significantly better immune response against those viruses. And so that's superior protection compared to just standard dose. So for example, the standard dose vaccines will have 15 micrograms of a certain antigen, whereas Fluzone high dose has 60 micrograms. So yeah, so that's why it's recommended. Next slide, please. All right, so there we go. The only thing I wanted to flag for you here is that it's about 25%, 24.2% more efficacious than standard dose in preventing lab-confirmed influenza in adults 65 years of age and older. Next slide, please. Well, why high dose? So the province, it's being recommended for long-term care and assisted living. And again, we spent quite a bit of time already this morning looking at, the disproportionate impact of folks in institutional settings and for folks that are over the age of 65. And so that intersectionality of those risk factors makes it really important for us to make sure that our folks 65 years of age and older living in care facilities particularly receive the vaccine. And those of us that have moms and dads and loved ones outside of these facilities, we want them to stay at home and independent. And so we want them to get the high dose vaccine. Next slide, please. Okay, so moving away from influenza, but also bringing it into the next slide, talking about pneumococcal disease. So pneumococcal pneumonia is what most of the time you'll hear about in the world of vaccines or communicable disease. So a lot of you will have already had your pneumonia shot, what we call, and that protects you against a bacterial pneumonia that often can be seen secondary to influenza. So it's another reason why we want folks to get their flu shots, but it's also a reason why we want people to get their pneumonia shots. Next slide, please. Here we go. This shows you the burden of illness of pneumococcal disease. Pneumococcal disease affects not just our elderly, it also affects our babies. So again, under 2, well, actually with pneumococcal disease, under 5 and over 65. In our younger ones, it presents more as like ear, nose, and throat problems, but they also can have meningitis and bacteremia. So it's a systemic infection in the blood. In adults, we see it more in the form of pneumococcal pneumonia, or what we call community-acquired pneumonia, CAP. Next slide, please. In BC, there are 2 pneumococcal vaccines. The one on the bottom of your screen is called Pneumo 23. That is a vaccine that is funded for all adults 65 years of age and older. What many of you won't know, though, that there is a pneumococcal 13 vaccine. This is a vaccine we give to our babies. It has been approved for use for people 65 years of age and older, but it's not covered by the Ministry of Health. So this is one of the vaccines that we'd also like you to talk to your healthcare provider about. Next slide, please, Kathy. A quick note about whooping cough, pertussis. There's a misunderstanding by lots of us that this is only a disease that impacts the young. That's not true. We know that whooping cough can be really problematic in adults as well. Whooping cough vaccine is available with a tetanus vaccine. And so just to flag for you that the next time you go to get your tetanus shot, which you should have every 10 years, your tetanus booster, that I would suggest, and this is what I've done for myself and my parents, thank you, Kathy, for doing that next slide, that you get the Adacel vaccine, or that you get a tetanus diphtheria pertussis vaccine. And that pertussis or whooping cough component will protect you against whooping cough. And it's not in the tetanus diphtheria vaccine that you'll get if you go to like Emerge, if you step on a rake, etc. So yeah, so we recommend the Adacel vaccine or a tetanus diphtheria and pertussis vaccine instead of just your regular tetanus diphtheria vaccine when it's due next. Next slide, please. Shingles, this is a big, this is a really big topic for those of us. My family and I get shingles all the time. I've finally had my first dose. It took me a long time because I had to go at least a year without my last shingles outbreak, and I get a lot of shingles outbreaks. Shingles is, it's where the virus that we get as children with chickenpox. When we have chickenpox as kids, the virus actually lies dormant. It sleeps in our spine. And then as we get older, again, our immune systems get weaker, and the virus comes out from our spine into our skin. I'll either get it on my face or I had it on my back. The pain associated with shingles is really, really problematic. Dr. Mike Oxman in the States, years ago when he was creating the shingles vaccine, did this study, and with devastating results. And that was that we call it post-herpetic neuralgia. So that is the pain associated with shingles. Is so bad that it was the #1 cause of suicide in people over the age of 65 in the United States. That the pain associated with it was too hard to treat. They couldn't get on top of it. It lasted too long. And so they ended up taking their lives. So the shingles vaccine was introduced in the early 2000s. The first versions weren't that immunogenic. The vaccine efficacy was around 65 to 70%. And now the new vaccines that we have now are just incredibly effective. And yeah, so if you look at the burden of illness, over 130,000 of us are diagnosed with it each year. And thanks, Kathy. 1 in 3 of us will develop it at least in our lifetime. We might see more of this now that we have fewer children running around with wild forms of chickenpox. We're not getting sort of those natural boosters, if you will, but the cost of natural boosting is that you have children with wild type varicella or chickenpox disease, you know, that are quite sick. So that's why we introduced varicella immunization with our babes. Again, so talking about how severe that post-herpetic neuralgia or that after pain, the National Advisory Committee on Immunization recommends shingles vaccination for all adults 50 years of age and older. However, it's not publicly funded in BC except for Indigenous clients, and it's funded through the First Nations Health Authority, and the phone number is there. I'll send that phone number around as well for folks. Thanks, Kathy. Yeah, and we just wanted to flag for people that it's very safe to get more than 1 vaccine at a time. So if you go in for one of your shots and you're not up to date with your pneumococcal or your Adacel, your TD, or your tetanus, diphtheria, pertussis, yeah, make sure that you get them. If you are planning your vaccines and you happen to know when you might get your COVID vaccine, just plan your other vaccines around your COVID vaccines, because the most important vaccine to get at this point in time is your COVID vaccine. And there are some time intervals that we recommend around that. Anyways, we don't want any missed opportunities. So we want everyone to get all their shots on time. Next slide, please. I think we're wrapping up here. Here's some more information. Immunize BC that's where myself and my colleagues work. Great resource there. Next slide, please. This is where you can find your local health unit, where you can talk to a public health nurse about immunizations and find a clinic where you can go and receive your immunizations. Next slide, please. And on Immunize BC, we have this amazing function. It's called Ask Us. So you're able to interact with the nurse. And I have the honor and privilege of supporting those nurses. So if they have a hard time answering your questions, they'll fire it to me, and yeah, and we'll support it. But I think it's a beautiful way for that the provinces come together, because as you know, that public health programs are based on the benefit of the public writ large. And, but vaccines also is a personal choice, right? And here's an ability where folks can, you know, take individual level decisions and ask it situated in the context of vaccine programs that are decided based on public and population health level decisions. Next slide, please. Yeah, and here's some more information, and I think we have some time for questions. We have 7 minutes. Please feel free to just unmute. Wendy, do you have a question?
I do. It's based on my own experience. First of all, Andrea, thank you so very much for such a clear presentation. I represent the Family Council at Lakeshore Care Center in Coquitlam, so I'll be sharing this with all of our members. Thanks, Patty. Now, when I went to get my my influenza vaccine and requested the high dose, I noticed that in this chat, Ken had also said, but what happens when you go and they don't have enough? That happened to me, and I knew that I needed to be asking for it. So I went to a few different places, and finally a pharmacist looked at me and just said, oh, you're going to be fine. This is fine. You just take this one and you'll be fine. And I did. And so I've been fine. But I would like your advice on how I can do this a bit more productively and efficiently next year rather than wandering around town knocking on pharmacy doors.
Yeah, thanks so much, Wendy, for that question. I mean, I'll be honest too, it was really hard for me to find that vaccine for my mom and dad as well. Yeah, I mean, and to be clear, sorry, I don't ever want to pit two vaccines against each other, right? I mean, we do know definitely that the high dose vaccine works better in seniors. But yeah, I mean, if you are unable to access it, and there was very limited supply this year in BC, we need to acknowledge that. And so we do. And I apologize for that. I mean, I apologize for that as systems level, because, yeah, like I think it's important, you know, when we have the data demonstrating the significant increase in protective capacity of a vaccine, you think it would behoove folks, right, to make sure that we had enough as possible. Anyways, here we are. Wendy, I hear on the street that that won't happen this next season coming up. You know, what I did is probably what you did. I put my name on several, you know, pharmacy wait lists, and I made it really known to several folks that this is something that I wanted. So yeah, I'm sorry, that's not very helpful, but I would just say, yeah, I don't think that'll happen this year. I think folks will be able to purchase it in a timely way.
Well, thank you for that, and no apology necessary. I just thought if I had missed the opportunity by doing it wrong, I'd appreciate the advice, and I see Ken had something on that.
Yeah, I posted a link there. It's a link called Stand Up Straight BC. It's sort of through CARP and through BCCRN, etc. London Drugs and Save On, you can actually register ahead of time to get it. They will actually contact you when they have it in, etc. But following up on what Wendy said, there are so many pharmacists that are not aware of the high dose, and it's really, really sad. I went around to several Shoppers Drug, oh, I shouldn't have said it, but several drugstores, and asked, I did a query, and I said, you know, can you tell me the difference, etc. Oh, no, you know, just as Wendy said, this will be fine. And yes, standard dose is better than nothing, but the pharmacist should be having a conversation. You know, what is your age? You know, do you have heart problems? Do you have lung problems, etc.? And they're not. And so part of the thing is we have to educate the pharmacist also. Thank you.
Yeah, thanks for that, Ken. I mean, actually, you know, that's a really valid point, and I'll take that forward to provincial tables, because we do have like BC Pharmacy there, the association and the college. And so, yeah, we need to make sure that we support pharmacists with that information. Thank you. That's a good point. Are there any other questions?
I'll ask one more. Why does BC not have a program like Ontario so that all of the people who are over 65 get it? And in Ontario, they're getting it for free because they have a program. We seem to have BC CDC getting in the way of a program. And I'm glad that Shirley Bond is on here, and hopefully we can get some push politically. We need to have a program so that immunosenescence is not a factor in BC. This is important. Thank you.
Yeah, thanks so much, Ken. So just to be clear, I mean, so so again, the process in Canada is that Health Canada approves the vaccine, NACI makes its recommendations, and then it is up to the individual provinces and territories to, you know, to decide what to do based on their own local epidemiology. So the BC Centre for Disease Control, they're actually, all BC CDC does is host the dialogue with all the scientists there, right? Like the physician epis, epidemiologists, et cetera. And then they make recommendations to the Ministry of Health. It's the Ministry of Health that makes the decisions on which vaccines to purchase and which vaccines to implement at a systems level. So sorry, I didn't know that Shirley was with us, but yeah, so I think, so if we're looking for political movement, that needs to be directed towards the Ministry of Health. But I take your point, like for those of us that work in public health, this is a really uncomfortable place to sit, right? When we're talking to people about publicly funded vaccines and non-publicly funded vaccines, it's very uncomfortable as healthcare providers because we're acutely aware of social determinants of health. We're acutely aware that the number one determinant of your health is your postal code. And so when we have clients with us that can't afford these vaccines, that's a really, really yucky place for us to be. So, I understand, like, again, bringing us back to COVID-19, that I think there is wisdom in sort of separating out church and state, if you will, right? So science from the folks that need to make decisions based politically on, cost and political will and those sorts of things. We're not naive enough that we don't understand the complexities of that. But to your point, Ken, we do want the government to start making better decisions around vaccine programs that protect our elderly, who I humbly would suggest have been overlooked.
I agree. And I see the Ronnies and the Larrys of the world who end up in hospital. If we can be proactive and fund all of those high-dose vaccinations for seniors, we're going to keep them out of the hospital. And I know it's a different silo of funding, but the hospital amounts that we have to pay for seniors who are having stays of 4 to 7 days, it would be used for other things. I know hospitals won't be empty, but let's be proactive on it.
Yeah. Thank you, Ken. Yeah, that's a great note, I think. Kathy, hey, to end it, did you want to wrap it up, Kathy? While you do that, I just want to say to everyone, thank you so much for having me. I'm so honored to be here. Ronnie, I am desperately grateful to you, and Larry for sharing your story. So thank you, Heichka. Yeah, thanks everyone for being here.
Thank you. Great. And thank you everyone again. Thanks to Andrea for providing us with an educational and entertaining and really easily understood presentation today. I also want to thank Shirley Bond for joining us today. Shirley is the MLA for Prince George and Mount Robson, and she is also the leader of the opposition. So thank you, Shirley. Please feel free to ask any of us any questions if you want to find out more. And also I want to just recognize the partnership that we have with Sanofi Pasteur, who helps us put on these amazing programs on flu and vaccine awareness education. I'll be following up with everyone today. I've put some links in the chat section, but I'll also go ahead and email you all the links to Larry's story. As well, we have a great flu awareness page on the BC Care Providers website, and we'll be posting the recording of this session, along with we have some other sessions, some that are intended specifically for frontline workers. So you can go ahead and if you do work in the seniors care and living sector, you can share that with your employees, as well as we have a great one on the COVID-19 vaccine. As well, I'd like to recognize that today is BC Senior